Let's talk a little bit about the Obamacare prices that we now have had a look at. I have to tell you, I don't think that it's mind-blowing. I was checking out here in New York State. They have released a lot of the insurers that will be participating in this health insurance exchange that will be run by states. They've released their prices. It's not mind-blowing. It's still very high. In many cases, you're talking $400 or $500 a month for an individual, a healthy individual for silver or better coverage. However, for silver coverage, I think those prices are. However, they are slightly lower, and now we have more data. The average price for basic health coverage purchased on health insurance exchanges created by Obamacare will be $249 per month. This does not count subsidies, which will be available, of course, based on income. These figures were released by the Department of Health and Human Services. The prices are going to vary widely depending on family size, age, tobacco use, income, of course. Even the average price of what is considered a bronze plan, which is designed to cover about 60% of medical expenses, not including the premiums themselves, the prices on the bronze plans also vary greatly. The average price of the cheapest bronze plan in Minnesota is $144 a month. In Wyoming, comparable coverage costs $425 a month, not including the subsidies. So very wide ranges, Lewis. For a lot of people, it will mean lower premiums. For some people, it will mean slightly higher premiums. The idea is that on the whole, you are bringing down premiums overall, but also covering more people. So I don't know. I mean, are you overwhelmed, underwhelmed? I have to say it's about what we expected. It's a policy that will put tens of millions of additional customers in the customer roles of for-profit insurers, with all of the problems that exist with having this for-profit insurance system. But it will reduce premiums slightly, and it will insure many more people. I guess it's good, but I'm not jumping up and down as if we had single-payer health care.
Right. I think the idea, one of the most important ideas behind this, and one of the most biggest hopes for it, was that it would kind of stabilize the healthcare industry, and prices would not continue to skyrocket, individual premiums. But I mean, time will tell. And of course, it is good that it helps insure millions of uninsured people.
Absolutely. The broader problem that we still have, which is the connection for most people between their employer and their health insurance, right? That's a problem. The fact that we have a for-profit system of healthcare when so many other countries at the level of development where the U.S. Currently sits have moved away from this for-profit mechanism, except for supplemental insurance if you want something above and beyond the government-provided insurance. But in the aggregate, we're going to see some benefit. Lewis makes a good point, though, which is I am curious to see whether the premium increases slow down at all. And the one thing that will not benefit from Obamacare is the elimination of the entire medical billing bureaucracy that exists, which is, Lewis, absolute huge part of the problem. You've got multiple layers of bureaucracy here, which all are paid staff.
I know it's incredible how chaotic and unnecessary the whole system is. It really needs to be streamlined, and we're so far away from that.